Welcome, and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. As many of you have joined our program, you've realized over the years that we try to approach a way that we can share information about how we might be able to reverse the irreversible. After all, many of us who approach midlife and beyond realize that sometimes our body just isn't living up to the promise of being able to live with vibrant health and vitality, and we try to find ways that we can stave off some of the things that might happen. In some particular cases, they might be extreme things such as multiple sclerosis. Could also be things like autism, as we're hearing more and more about. Joining us here on the Beyond 50 radio program today is someone who has actually treated a condition she's had, such as multiple sclerosis, for more than 10 years. She decided to establish a research trust back in 2004 and runs this trust raising awareness of what is known as low-dose naltrexone. Low-dose naltrexone is apparently something that's done in very low doses. It's a generic drug that's extremely affordable and presents very few known side effects. So we're going to talk about this today, find out more about that and what it does and what this trust helps people to understand and do when it comes to being able to reverse things that this might be able to do. I'd like to welcome to the Beyond 50 radio program today our guest, Linda Ellsgood. Linda, thank you for joining us around the program today.
Hi, Daniel. Thank you for inviting me. I'm excited to share my knowledge with you.
Now, I looked into this, and I discovered that it was back in the 1970s that apparently LDN, as we'll call it from this point forward, was something that was actually used to help people with addictions, to things such as alcohol as well as heroin. So what was going on? How did this come about?
Well, if I can correct you, if you don't mind.
That's what we've seen, so...
Okay. So back in the 70s, it was actually naltrexone in its full strength. And it was, as you say, used for alcohol addiction and heroin. But it was used in 50 milligram doses 3 times a day, and it blocked the opioids. So it stopped you from getting high. So you could still take the heroin, but you had no effect whatsoever. It didn't give you that boost or whatever alcohol and heroin gives you. It blocked it completely. And it was trialed, naltrexone, and it was only found harmful to the liver in doses of 300 milligrams a day. Now, the addicts were only taking 150, which was half of what you would need to take for it to be harmful to the liver. And we're talking about low-dose naltrexone, and the dose is like 3.5 to 3 milligrams to 4.5. So it's very, very, very low. It was first reported as being used by Dr. Bernard Bahari in his clinic in New York, and he was using it in his HIV/AIDS clinic, and he was noticing that some of these people with HIV/AIDS also had autoimmune conditions that it worked really well for, and he prescribed it for a friend's daughter who'd got multiple sclerosis, and she took the LDN, and amazingly, her symptoms disappeared. She got her life back. She carried on, and she thought, you know what? I don't actually have multiple sclerosis. It was a misdiagnosis. So why am I taking something when I don't need it? So she stopped taking it. And then she had a relapse and she reverted back to how she was. So on that note, I have been taking LDN for over 13 years with amazing results. And there's no way I'm ever going to stop taking it. I don't want to go back to being the sick person I was before LDN.
Well, that sounds pretty remarkable considering the fact that when we see a typical treatment for, let's say, multiple sclerosis, it seems to be more of a situation that has you living with the symptoms rather than, helping you to thrive, so to speak. Has that been the case with you?
Exactly. And if you listen to doctors talking about LDN and inflammation in the body, they talk about the fire within being out of control, all this inflammation. And MS medications help the symptoms of that fire, but it doesn't actually help to put the fire out. So LDN is meant to, Professor Ian Zagon, who has done lots of studies in mice over the years, and he has found, and he was doing it at the same time that Bernard Bahari was prescribing LDN right way back into the late 70s. And he says that LDN helps regulate a dysfunctional immune system, which I think is a good way of putting it. And as trials and studies have gone along since that time for LDN, it's also found to help reduce inflammation in the body, so it actually helps to put that fire out. And then with regulating your immune system as well, it actually helps people reduce their symptoms, and it's, as we were saying, not only multiple sclerosis, but autoimmune conditions, which can encompass Crohn's disease, rheumatoid arthritis, type 1 diabetes, ulcerative colitis, fibromyalgia. It's also used in pain conditions. There are many pain specialists prescribing LDN for pain, autism, juvenile arthritis, eczema, asthma, all of those kind of things, and cancer. And then some people will say, well, how can one medication work for all of these conditions? It's because there is an autoimmune component to all of those conditions. And it's also used in mental health as well. So it's really interesting hearing all the different stories. And we have a conference coming up in Portland in 2-3 weeks' time, where there are these expert LDN prescribers and researchers. They're sharing their experience of LDN. It's not only for the medical profession, but for users as well. And it's absolutely amazing, the fact that you can actually ask your questions that you may have about your condition and whether LDN would work or not, and get the answer straight away. You don't have to actually be there in person. It's live streamed, so you can actually do it from your own home, which is another plus point when you have a chronic condition, because it's not always easy to get to a venue and actually sit through a whole day's lecture. So you can pick and choose what you want to watch, and it's all pre-recorded, and you can watch it afterwards as well. But the reason why it's not so widely prescribed is that it's what they call off-label on a named patient basis. And if we go back to the 70s, when Naltrexone was first used, drug companies mainly are the drivers for clinical trials. They're drug company driven. And then once it's been trialed, they put the price quite high to recap all the money from the trials that they have done and to make a profit. And after which point it then becomes a generic drug when that patent runs out. So everybody is able to make Naltrexone. Compounding pharmacies make it in the US. It's a bit different here in the UK. We have to have a specials company make it. We're not allowed to compound anymore. But I'm going to put myself off now. So doctors can prescribe it off-label on a named patient basis for any condition that they like. But when you prescribe off-label, it does mean that 50% of the responsibility of the drug is with the prescribing doctor, and the 50% is with the compounding pharmacy or the pharmacy, depending where you live in the world. So you can get it, but it has to be a doctor who is willing to prescribe it for you.
Now, I was thinking about that, that here you have something that sounds pretty relatively affordable when it comes to, let's say, a pharmaceutical. That's almost an oxymoron, because they want to charge you as much as they can, it seems, for particular drugs. Mm-hmm. And then you see something like this come on that's not only affordable, but you use in very low doses. So that means that you're actually using this over long periods of time without a big financial outlay, so to speak. And the reason I wanted to bring that up is I remember attending, actually on a couple of different occasions, a diabetes exposition. And what I seen consistently there was ways to find how to live with the disease, rather than finding ways to reverse the symptoms. And we're talking more specifically toward type 2. But what you're seeing, and we've certainly had on the program, there's a gentleman that's out in, I believe it's Arizona, with a Tree of Life Foundation that is reversing type 2 diabetes fairly consistently, and in some cases, very extreme cases of type 2. And so that you know that this is possible, and a lot of it is mostly due to dietary change and lifestyle, which I believe is a component for pretty much all diseases for the most part. And that's just my opinion. But, that being said, that here at this expo, they were finding we're going to, share these medications and these procedures as a way of living with the disease. In other words, we really have no desire to see you reverse these symptoms and get off all of this stuff, because then we lose money. This seems to be kind of one of them situations that almost mirrors something like that. Does that sound pretty accurate?
It does, yes. And if I could just go back to what you were saying about it being cheap, it's in the US about $1 a day. So it's affordable for people. I'm sure if you were a smoker, you'd spend more than $1 a day on cigarettes. I don't know what the price is over
well,
there.
You're going to spend more than $1 a day. It's like up to $6 a pack now. And it's, that's what's funny about that. We're willing to spend that kind of money on something that really isn't all that great for you. I'm not going to say that it's bad, but it certainly never made me feel good, for that. But yet, we're going to kind of, hightail it and run when it's something like this. But anyway.
And you were so right about dietary things, other than having MS. And I'm 61, and I started to become ill when I was 13. I had what is now called Epstein-Barr virus, and then I obviously was having relapses. Things would happen, and then I would be fine, and then something else would happen. Numbness, weakness of legs, chronic fatigue, but they were all temporary. So it wasn't until you look back that you put all the pieces together that you could see that I'd had MS for a long time. But talking about diabetes, I'd already been on LDN. I'd been diagnosed before LDN. I'd had, I don't know how much detail you want me to go into, but anyway, with my MS, I was really, really sick, and I was in a wheelchair, and I lost the hearing in my left ear. I had double vision, and I had a course of intravenous steroids. That really didn't do much at all. 6 weeks later, my neurologist decided to give me another 3-day course of these intravenous steroids, and you only meant to have one course every 18 months. So 6 weeks apart wasn't good news. And I asked why he thought it was necessary, and he said he was worried that I was going to become deaf and blind. So it was like, yes, okay, we'll have them then. Not realizing that having so many steroids, I blew up. I was enormous. I was in bed for a long time. I had about 18 months in bed. Then I was in a wheelchair. And when I could get dressed, nothing fitted me by about, I don't know, I'm still in inches, about 4 inches. Nothing. I couldn't push anything round me. So I said to my husband, just go out and buy me something that's tent-like that I can put on to actually go to buy some clothes. The upshot of that was I then became a type 2 diabetic, which was really annoying, heartbreaking. So I was diet controlled for a while, and then I had to take metformin. And my diabetes was fine. I started LDN, and the diabetes was getting a lot better. I didn't have to take such high doses of the metformin, but I was still taking the metformin. And it wasn't until I went gluten-free, dairy-free, and processed sugar-free as much as possible, my blood test results showed that I was a diabetic in remission or / pre-diabetic, where it showed that I could become a diabetic, but I wasn't actually a diabetic. But once you have been given the label diabetic, they can't take it away from you. It still means if I'm not careful, I could still become a diabetic. So I'm really pleased with that. It's bad enough having one condition without having a second one. So yeah, so I'm pleased, but I can't be silly. I can't go out and eat, lots of sugary things, because I'm sure that would tip me over the edge again. But if I'm careful, hopefully that will stay at bay.
So what I believe I'm hearing you say is as a result of treating your multiple sclerosis, let's say the traditional way, because of what they had you taking, and plus some of the dietary choices that you made, that's what put you into a diabetic realm?
Well, at that stage where I became a diabetic, I wasn't really eating that much because I was in bed really ill. So it really was the medication, I would think, and lack of exercise that caused it. I don't know whether it is slightly hereditary. My grandmother, my father's mother, died of diabetes. They didn't know she was a diabetic and she went into a coma. My father and my mother became type 2 diabetics when they were older. So who knows? Maybe I was heading that way anyway. I don't know. But touch wood, hopefully that's not going to be an issue for me now.
Now, one question I have, and I guess is because I misunderstood this, this was before we decided to do this segment here, has LDN been used for the treatment of the symptoms of Alzheimer's disease?
There are some doctors that are using it for Alzheimer's, which is really interesting. Yes, definitely. And there is more research being done as well, which I'm not that clear on at the moment, but it's something that will be announced hopefully not too far in the future.
Okay. Yeah, I just wanted to be clear about that. Now, you have a not-for-profit charity. Tell us why you set that up. What is its mission, its goal for our listeners?
Okay. I had been told in October 2003, and at that point, I had no balance. I couldn't stand. The strength of my legs used to go, so I used to trip and fall and stumble, and I used to spend a lot of time on the floor, because when you have really bad vertigo, it's as though you've been on a ride at a fun park. Everything spins and you just have to lie there till it settles. I had cognitive issues where it was though English was my second language and I couldn't recall anything. Everything I said became jumbled and muddled, and the scary thing was I was thinking I was getting dementia because it was awful, absolutely awful. And my husband used to correct me because I would say to him, "Can you make me a cup of tea? I've never drank tea in my life. I don't like it. I only drink coffee." And I would call a cat a dog. But in my mind, I used to think I'd said things correctly. I had burning and numbness and pins and needles and pain. I lost my bowel and bladder control. I'd got this awful double vision, the loss of the hearing in my left ear, and I slept an awful lot. Chronic fatigue was a big problem. At one point, I was awake for 4 hours out of the 24, which was a blessing because I didn't feel so ill once I was asleep. But came that I'd got to have this appointment with my neurologist, and he examined me, and he sat me down after he'd examined me. I don't know why he did that, because he reached across his desk and he shook hands with me, and he said, "I'm really sorry to tell you you're secondary progressive now, and there's nothing more we can do for you." And as he was saying that, he got up and he opened the door to show me out. And I really thought that, okay, whatever we're doing isn't working, so what's plan B? But it
right.
there is no plan B. That is it. End of. There's no discussion. And I can remember saying to my husband coming home in the car, I felt as though he may as well have said, "Go home, die quietly, you're an embarrassment, there's nothing we can do." That is how I felt. Unbelievable. So it took me a while to get my head around it.
Kind of makes you wonder why he decided to go into that profession if that's his attitude, huh?
Oh, there are some worse horror stories than that I've heard from people.
And it's funny, too. Here's also a way to look at it real briefly, is that you go to the hospital to basically reverse that you're not sick enough, that you feel confident in leaving, that you won't go back and sue the hospital because they didn't. Who knows? Sometimes you wonder about that.
Yeah. So what was I saying?
So you were being sent home with no hope in sight.
Exactly. Mm-hmm. So I actually contemplated ending it all because I thought that would be easier for my family, because I wasn't able to contribute to anything. You know, I couldn't set myself the smallest of tasks to do. I failed absolutely everything. And I'm quite a competitive person, I guess. I like achieving things and reaching goals and targets and aims, and I was just failing everything. But anyway, I could manage to spend 10 minutes at a time on the computer, and that was it. When I went to my many trips to the toilet. And it took me a while to find LDN. I knew that there had to be other people in a similar situation to myself. I knew I wasn't unique, but I didn't know anybody. So I was trying my hardest to find out what other people were doing. And I found in the US that there were people using LDN for multiple sclerosis. And these people, some of them were willing to talk to me, and they all said the same thing, is that if it wasn't going to do me any good, it wouldn't do me any harm. So I then tried to find somebody in the doctor in the UK who would prescribe LDN for me. I printed information off and took to my own doctor who wouldn't prescribe. I had a new doctor, and she said that if I could find somebody to prescribe it for me, she'd be happy to monitor me. So I managed to get a private prescription, and she monitored me. And it was absolutely amazing. 3 weeks after starting, and I was very disappointed in that 3 weeks, because some people spoke of side effects where you could have worsening of pre-existing symptoms, headache, stomach upset, vivid dreams, sleep disturbance. I had nothing. I could have been taking a peppermint sweet or a paracetamol. It did nothing, and I was devastated. I wanted all of these side effects because I wanted to know it was working. I'm impatient as well, you see. And it did nothing. And then suddenly, 3 weeks after taking LDN, it was like, whoa. And I woke up, and in the bedroom there was a picture on the wall, and it was always double vision where you could see it twice to the side a bit, how you doodle a box, you know, and right. it double. And this morning I woke up and I could see the picture frame. It was level. It didn't all twist and distort. And then I noticed that my hearing was a lot better, and I was able to stand better when I got out of bed. And it was as though all the pieces that were broken were mending and fitting back in together. It took me 18 months, mind you, to get back to what I would have called a good quality of life, but it improved after 3 weeks noticeably, and that was absolutely amazing. So the reason I started the LDN Research Trust was, did I want to say, I'm okay, fantastic, let me get on with my life, or did I want to shout from the rooftops and try and help those people that were in that deep, dark place that I was in, who perhaps weren't able to get out of it? So that is why I wanted to spread the word, and to spread the word, it seemed the only way I could do that with any credibility was to set up a charity. It took 5 months to do it. It took a lot of money at the time because the Charity Commission didn't want us to become a charity. They said research couldn't be a charity. So I said, well, we have a big charity, cancer research, but cancer research is a condition, not a drug. And it was amazing. 5 months I had to go through one department, and then they keep arguing on point 6 and point 24 and point 50, and we would resolve all of that, and I'd think, okay, we're there now, and then they'd pass it on to the next department and it'd start all over again. And I think perhaps a lot of people would have given up, but I am very stubborn, and 5 months later we became a registered charity, and we've done so well in that amount of time in helping people. Initially it was people in the UK, and then it started to go to Europe, America, Canada, New Zealand, just about every country. And it mainly started off MS, probably because I've got MS and more people were using it at that time. And then Jill Smith did a Crohn's study, and then we've had fibromyalgia, we've had pain. And so as the small trials and studies have been done, and people who have an autoimmune condition realize that it does work if you have an autoimmune component. And we know of over 240 conditions now that LDN is being used for. So it's pretty amazing. I mean, people who have psoriasis, for example, if you know anybody who has psoriasis, it's like a form of eczema, but worse. And psoriasis is one of those conditions that it does take a little bit longer. But after like 6 months, all those horrible, scabby rash, if you like, I can't think what they call it, but it all becomes clear, and people tend to have normal skin that grows back, and it looks absolutely amazing. And we had a young girl who had alopecia, and she lost her hair, her eyebrows, eyelashes, all her bodily hair, and that came back with using LDN. And amazing stories of ulcerative colitis and Crohn's disease and cancers. And I'm just always blown away by these people who have such amazing stories to tell. So that is why I wanted to help people and help people we have. And the conference is a really good way of not only making people aware of LDN, but it gets other doctors comfortable to prescribe LDN because they can actually listen to prescribers, listen to stories, ask their questions. And also we launched last year the Ldm Book, which has become a bit of a Bible for LDN prescribers. It's a little bit technical for the layperson, but there is enough information in there to make it interesting for just about everybody.
Well, very good. And I also know that you have a Facebook group with more than 22,000 members, I understand. We have a radio show. We also have a Vimeo channel. There is a health tracker app that people can find out more about. And they can find out a lot about this. Is there a website they can go to where they can find out all of this information?
Yes. Our website is www.ldnresearchtrust.org. And there are two different pathways if you are a patient or if you're a medical professional. And everything is there that you could need. And we have an information pack which you can take to your doctor. It explains what LDN is, the mechanism of action, possible side effects, dosing, clinical trials. There's everything in there that you could possibly need to know. We always suggest that people try their own doctor first to see if they will prescribe it. And if they're not willing to prescribe it, we have a list of LDN prescribers around the world which is held privately. We can't put any doctor's details on the website without their expressed permission. But there are quite a few doctors on the website who prescribe LDN. And it doesn't have to be a doctor, although we do work with rheumatologists, gastroenterologists, neurologists. But it could be an MD, NDs in some states in America and some countries, physician's assistants, nurse prescribers. But if anybody needs help...
It sounds to me like they can get pretty much everything on the website, at least directionally speaking. And
yeah.
That's very good. Linda, first of all, I'd like to thank you for taking the time to share this with our listeners here on the program. And it's pretty important also for them to understand that if this is a way that you can hit that reset button on your health, then maybe you might want to also start considering the lifestyle choices that you made that may have led you up to this point in the first place. Because certainly, taking this and perhaps this may be changing things for you for the better is fantastic, but it doesn't do any good if you just revert back to the way you were living. Certainly want to keep those things in mind. And Linda, thank you so much for joining us here on the program. And for the listeners, one more time, give out that website again.
www.ldnresearchtrust.org.
Very good. Linda, thank you again for being on the program today.
Thank you for inviting me.
We want to thank you, the listeners out there, for tuning in. You can also discover more by visiting us at beyond50radio.com. That is the number 50. We'll have links there for you where you can discover more and share it with friends as well. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program. And remember, live your day past halfway.